Are you feeling tired, gaining weight around your belly, struggling with your blood sugar control, struggling with your blood pressure, struggling with sleep and energy and fatigue and brain fog? You could be facing metabolic syndrome. And guess what? The ketogenic diet may be a natural solution for you. Hello, everyone. It's Dr. Tidman. Thank you for stopping in for another one of my videos. Frequently, I review research, and then sometimes I'll post a video about a particular health topic. Metabolic syndrome is a newer diagnosis, but it is rapidly becoming the foundational diagnosis for many of our metabolic health conditions. It's a silent epidemic affecting millions worldwide, and people don't even know they have it. In this video, I'm going to break down what is metabolic syndrome, what are the main causes of it, and how the ketogenic diet can be a powerful tool to reverse your symptoms of metabolic syndrome. So if you're dealing with high blood pressure, dysregulated blood sugar, lots of belly fat, abnormal cholesterol levels, stay tuned and learn how a low-carb approach can help with all of these symptoms. Whether you're trying to lose weight or just deal with your brain fog and your fatigue, I think you'll find some helpful suggestions in this video. I'm going to talk about the topic and define metabolic syndrome. I'm going to review a study and discuss what the author's findings were, discuss their conclusions, and then relate their conclusions to my final tips that you can do at home. This is the article that I'm going to be reviewing by Neeland et al. In 2024. Remember to subscribe if these videos are helpful, and drop a comment below and let me know if you have a question. So, what is metabolic syndrome? Originally, it was called insulin resistance syndrome, and rightly so. The main root cause of metabolic syndrome is insulin resistance. So what are the 5 criteria that you have to qualify for this diagnosis? You have to have high blood glucose. That is, your hemoglobin A1C reading is above 5.6. Yes, I said 5.6. That means if your hemoglobin A1C is 5.8 and your doctor says, oh, you're just fine, you're just pre-diabetic, well, it's kind of like you're either pregnant or you're not. You either have diabetes or you don't. Pre-diabetes isn't, oh, at some time you will develop a problem with your blood sugar. That's not what it means. It means that you already have a problem with your blood sugar. So don't think just because your A1C is 5.8, you're home free. This is one of the qualifying criteria for diagnosis of metabolic syndrome. The second criteria is you have high triglycerides. They're above 70. Now run and get your last lab results. What were your triglycerides? If they're at 100 or 130 or 150, your doctor's going to say, you're just fine. They are fine. No, they are not fine. It's kind of like pre-diabetes. If your triglycerides are above 70, your body is having trouble with triglycerides. You're already having trouble. That's the second criteria that qualifies you for a diagnosis of metabolic syndrome. What about your HDL, your high density lipoprotein? These are the good guys, the good cholesterol, if you will. Is your HDL below 50? If so, that means you're already having trouble handling or recouping healthy fats in your bloodstream that are anti-inflammatory and protective. Your doctor probably won't even address these. What if your HDL is 30? Your doctor may tell you that's absolutely fine. No, it is not fine. It is the third criteria that qualifies you for the diagnosis of metabolic syndrome. What if you have a large waist measurement? Now, what is large? For men, over 40 inches. For women, over 35 inches. So, again, this is one of the criteria for metabolic syndrome. Why is this important? Because we know that insulin resistance causes a collection of fat around your waistline. This very simple, low-tech method of measurement tells us, is your body collecting damaging fat around your middle, around your vital organs? So grab out your tape measure and measure your waist. Do you qualify? This is the fourth criteria for qualifying for metabolic syndrome. The final criteria is, what is your typical blood pressure? Now, this is not the blood pressure that they take at the doctor's office. Very often, the highest blood pressure you will ever have is at your doctor's office. If you're concerned about your blood pressure, obtain a blood pressure monitor and test it at home. During the day, all different kinds of day. See what your blood pressure is typically. Is it typically above 130/80? Okay, you have the fifth criteria for qualifying for metabolic syndrome. Yes, I spent a lot of time on this, but I want you to know and be aware of these criteria. The authors explored some complex mechanisms that create the situation of metabolic syndrome. They went into a lot of detail on some of the genetics involved that I don't even understand all those details, but the article will be linked in the description for you to review for yourself. They also really emphasized the foundation of insulin resistance, prolonged high levels of insulin, creating a blunting of the insulin response in your cells. An excess accumulation of dysfunctional fat tissue, especially around your waistline. Abdominal obesity is what we're calling this. High levels of systemic inflammation, testing with markers like HSC reactive protein. In my Bloodwork 101 series, I go into some detail about testing for inflammation in your lab work. And dyslipidemia, that is a dysregulation of your cholesterol. This means high triglycerides, low HDL. The prevalence of metabolic syndrome in the U.S., these are U.S. figures, first of all, between 2011 and 2012 were 37.6%, increasing to 41, almost 42% between 2017 and 2018. Here in 2025, I wonder what these percentages would be. A lot higher, I would predict. The levels in Canada that I could locate were taken in 2009 and were estimated in Canada to be 42% people who qualify for the metabolic syndrome diagnosis. What about Mexico? I'm glad and thankful for my international listeners. I hope these are helpful. This is helpful content for you. In Mexico, almost 29% of men and 44% of women qualify for the diagnosis of metabolic syndrome. In the UK, taken from their biobank of 308,000 participants, 24.5% of the data collected showed that 24.5% of the population qualifies for the diagnosis of metabolic syndrome. In Japan, 17.9% among men and 9.2% of adolescents in Japan qualify for the diagnosis of metabolic syndrome. In 2020, South Korea, 33% of the population qualified. About the same year in China, almost 20% of the population. In India, hello, my listeners from India, approximately 30% in 2020 qualified for the diagnosis. And in Africa, when 29 countries were surveyed, 32% of the population qualifies for the diagnosis. So we're not talking about a rare diagnosis at this point. I imagine the numbers in 2025 would be much higher. Now, prevalence of metabolic syndrome in children. What do you mean, Dr. Tidman? Children can be diagnosed with metabolic syndrome? Yes, they can, unfortunately. Between 2001 and 2020, in adolescents, 2.6% of general population adolescents in the U.S. would qualify for this diagnosis. Now, adolescents of Hispanic descent had an even higher incidence at 3.73% in 2020. In South Korea, 2019 to 2020, the incidence of metabolic syndrome rose 7.79%. And in India, in children, it went from 3.4% to 5% of children diagnosed with metabolic syndrome. In China, in 2020, 5.45% of adolescents, children and adolescents between 7 and 17 years old, would qualify for the diagnosis. Common features: the fat cells around your middle. Hypertrophy, that is, they grow in size. Each individual fat cell grows in size. They also grow in the number of fat cells. You have impaired creation of these fat cells. They're very dysfunctional when they're created. They are insulin resistant. They do not hear the signaling of insulin. Therefore, you have impaired fat burning. They're not utilizing those triglycerides that are floating through your bloodstream, so your triglycerides get higher and higher. These fat cells, these dysfunctional fat cells, create inflammatory cytokines. These are molecules of inflammation. And they're not vascularized very well. They don't have good blood flow. This causes variance in some of the genes and how they're expressed. It really disrupts fat accumulation in women with hormonal changes like in menopause. Metabolic syndrome is also associated with steatotic liver disease. We call it non-alcoholic fatty liver disease or non-alcoholic Steatohepatitis. These terms are being changed to metabolically associated steatohepatitis or metabolically associated fatty liver disease. Metabolic syndrome also causes adipose tissue, adipose fat cells to be deposited in your kidneys, in your kidney cells, which affects your blood pressure and can lead to chronic kidney disease. Of course, inflammation is closely linked to insulin resistance and this dysfunction in fat cells. One of the people I love to listen to is Dr. Ben Bikman, who prides himself on being a fat biologist. And he has a number of excellent YouTube videos on dysfunction in fat cells and how important this is. So check out his channel. The Metabolic Classroom, I believe, is what that's called. And then, of course, you have a lot of fat accumulation in your vessels and fat accumulation in your heart muscle. So the fat invades every tissue as the insulin resistance grows and your metabolic syndrome becomes more serious. Common treatment approaches, you've heard these. Yes, you have. Lifestyle modifications, healthy dietary patterns. That doesn't mean low fat, y'all. It means low carbohydrates. It is your high carbohydrate consumption that leads to this fat dysregulation, insulin resistance, and metabolic syndrome. Physical activity. Exercise, growing your muscle development, which helps to control your glucose, which then controls your insulin, reduces your insulin resistance. It is that cycle, that sequence that we want to see to help your metabolic syndrome. Manage your excess visceral fat, the fat around your waistline. Something that can be helpful for you is to ask for a DEXA scan. Now, there are two different types of DEXA scans. You've heard me talk about DEXA when it comes to bone density, but you can also get a DEXA scan to determine your fat accumulation and your body fat percentage. You can also use CT angiography and CAC, coronary artery calcium scans, to see is this fat accumulation and high triglycerides and metabolic syndrome causing fat accumulation and plaque accumulation in my arteries. An accurate and early assessment of metabolic syndrome really helps to reduce your risk. The authors really talked about early assessment of metabolic syndrome, which is not currently being done. Of course, we know that the metabolic surgeries, gastric bypass and sleeve procedures, do reduce your blood glucose, your insulin resistance, and can help with symptoms of metabolic syndrome. But it's a rather drastic treatment method. The GLP-1 and GIP medications, which are so hot on the market right now, can also reduce your insulin resistance and help reduce the symptoms of metabolic syndrome. Remembering that there are quite a lot of side effects associated with these medications. Public health approaches can be stimulating physical activity in people and overall quality of nutrition, the authors talked about. So, what are Dr. Tidman's tips? You know them. You can recite these from memory. Reduce your daily carbohydrate and sugar intake and processed foods. Get rid of them. You don't need them. Your body doesn't tolerate them if you have metabolic syndrome. adopt a ketogenic approach. When you're testing your blood sugar and your ketones using your new meter that I told you to get, you're going to see your glucose needs to be under 100 milligrams for fasting. And if it isn't, then your body isn't handling glucose very well. Get those healthy fats to get your ketones up. Take out those sugary juices and drinks and power drinks. Yes, I said power drinks. And energy drinks. And grains. Your body doesn't know what to do with these, obviously, because if you have metabolic syndrome, your body is crying out for help. You need to change something. Of course, daily exercise, we cannot underestimate the power of increasing muscle mass through resistance training and strengthening your cardiovascular system through aerobic training. You can use natural ketone supplements like MCT oil or coconut oil. And then, of course, fasting is a wonderful way to increase your ketones, reduce your insulin and blood sugar. I hope that these tips have been helpful and that review of Nealon et al.'s article has given you some things to think about. I'll link the Nealon article in the description so you can read it yourself. This was another one of my videos. This one targeted metabolic syndrome. What are the criteria that qualify you for the diagnosis, and what can you do about it? Thank you for stopping by. Remember to subscribe, like the video, and drop a comment below. Tell me if this was helpful for you or if you have a question that I can answer. Stay tuned, and I hope to see you in the next video. Take care, everyone.